Parents who worry about their children participating in school sports may be right to be concerned. North Texas doctors say young athletes are still facing a culture of resistance in which the parents and sometimes the children themselves are unwilling to report an injury for fear of the children being stuck on the sidelines. CBS 11's Brian New has the story, new at 10.
When her 10-year-old son is on the ice, it's not the puck she's watching, but the hits.
I think it's always a concern, especially at this age. Because
like most moms of young athletes, Paula Greenman is aware of the dangers of concussions. But a new study from the National Academy of Sciences says research on youth concussions is limited. It's unknown how many kids suffer a sports-related concussion and what the long-term effects can be on a still developing brain.
We're more concerned about the long-term effects of an injury that occurs in a younger brain than it does in an older brain that's more fully developed.
Dr. Shane Miller sees it every day at Children's Medical Center. Wednesday, he examined 8 patients with symptoms. He says at times it can be difficult to diagnose, especially when a young athlete tries to hide it.
Sports are big here, and parents are concerned that if their 8-year-old is not back out on the playing field for that next tournament, that they may not be playing in college. And really, we're aware that's not the case.
This culture of resistance, the National Academy of Sciences says, not only leads to the underreporting of concussions, but also endangers the well-being of young athletes, and not just today, but for years to come.
after every game, I ask them how they're feeling, and especially if they get claimed against a board or back checked, and to make sure that they're doing okay.
Greenman says at 10 years old, it's hard for her son Jack to look past next week's game, but that's why she's here to remind him. In Collin County, Brian New, CBS 11 News.